Hey everyone, Ashley with Amare, and today we are going to talk about a very common procedure that you guys also asked me about, which is a BBL, Brazilian butt lift or fat transfer. So BBLs are often and commonly done with lipo. Why? Because they're taking your fat out and transferring it to another part of your body. So they have to get the fat from somewhere to do the transfer. Now, you can get butt implants, which go under the muscle, or sometimes over if you don't have enough fat. Same way you could get breast implants, but you can also get a fat transfer to the breasts to give you a little bit more curve, to give you a little bit more volume. Same thing with the BBL. You're getting fat put into the glutes, around the hip region, the hip dip area, to give you a nice shape. So how does this work? Well, when we get lipo, they are taking a cannula and they're sucking fat out, and it goes into kind of a container, which you can see videos and tons and tons and tons of pictures and all of these things from surgeons on YouTube and surgeons on Instagram. They are out there if you look. So this lipo gets sucked into a container. Then it gets kind of cleansed or spun, and then it gets re-injected into the body. So, of course, every doctor has, their ways of doing these things. To get into more technically, I would suggest looking up those surgeons' pages to figure out how it's done and see the exact process. Again, I am not a doctor. I am just a recovery specialist. So all the technical stuff about how the BBL works, that you can look up a surgeon's page. Any of your favorite surgeons that do BBLs should have the process on there at some point with them doing it. So anyway, BBL, they take fat out, they put fat back in somewhere else. Well, how does it work? So week 1 to 3, after they put the fat back in, let's say to the glutes, right? It's gonna blow up. Your body is gonna create a protective pouch of fluid around the fat. So your glutes are gonna be pretty hard and pretty swollen, and that is normal, and they are supposed to be. So with a fat transfer, fat is a stem cell. It takes 6 weeks, 5 to 6 weeks, maybe a little bit more than that, depending on your body, for the fat to stick to the area and the tissue. So it sticks, it creates blood vessels, we get healthy fresh blood and lymph to the area, and it becomes a part of your body and permanent. That's how we get a BBL. So 1 to 3 weeks, we have a lot of swelling. It's protecting the area. By week 3, it starts to come down, which makes your BBL look like it's shrinking. We have pictures before and after, as well as 1 through 8 sessions where you can see all of those changing of shapes, all of the ugliness in between before they get to that nice, perfect, fluffed BBL. So weeks 3 to 6, something happens that's called fluffing. Anywhere in between there. Weeks 1 to 3, you're usually still pretty hard. It kind of feels like a rock. It's still kind of numb. It starts to come down once the swelling starts to come down. Now, to be very, very clear, we do not touch BBLs. No manual lymph drainage therapist should be touching BBL work. We want that fat to stick. We don't want anything to crush it. We don't want anything to alter it. We don't want anything to squeeze or touch or anything. So weeks 1 to 6, no sitting, no laying on it, no tight garments, which we will get to in a minute, on any fat transfer, top or bottom. And we want to make sure that you're taking care of it and being conscious of your BBL. We don't want anything squishing it, touching it, cutting into it, nothing like that. If your surgeon has to touch your BBL because of some complication, which we will also talk about, that is a different story. But no one other than your surgeon should be doing that, and even your surgeon probably would never do that. Because again, a BBL is something that needs to stick. Unless they are going in and surgically altering it, you shouldn't get any massage over that area. No one should be touching that, especially you sitting on it or laying on it. Your BBL must be protected at all costs. So they put the fat in. They do a lot to make sure that that fat sticks and is protected. Sometimes they'll do a little extra than you ask for, just in case you lose a little extra. I do know a couple surgeons that we do work with in Miami as well as here who will freeze extra lipo fat just in case you need more in your BBL by the end of that 3-month, 6-month range. If you're still not happy with it, they can inject a little bit more if you have enough fat to take. If you don't, and you still want to get some sort of volume back there, you can get implants. The same way you get implants in your chest, you can get them in your glutes. So that is one way of doing it outside of your Brazilian butt lift, which is a fat transfer of the fat from your body, from lipo, into another area of your body, such as the face. They can use it as fillers. The boobs, they can use it for cleavage. They can give you an extra cup size with it, or the glutes. Those are the 3 most common places that fat transfer is done. BBL is strictly Brazilian butt lift, so that's only in the butt. So weeks 1 to 3, it's really hard. Weeks 3 to 6, it starts to fluff and change shape. It looks like it's getting a little deformed. It looks a little misshapen. And then by week 6, it's soft and fluffy, like nice, healthy tissue. So what's happening in between that time? Well, when it's swollen, the fat is in there. It's liquid. It's just floating around. Then it starts to stick. Then it starts to become hard. As the swelling starts to come down, you're going to notice that it starts to change shape. That's week 3 to 6. Why? Because where there was more fat transfer, it's going to be harder and take longer. So a lot of times when we want roundness on the sides, if we just did the sides, it'll go from the center and then the sides will be the softest at the last 6 weeks. If we're doing it for volume and we put a lot right in the center and we want it nice, big, and projected, the sides usually soften first because that's where the least work was done. So the areas that the least work were done in is the areas that are going to start to fluff and soften first. A lot of people say the fluff fairy comes by week 4, 5, and 6. And again, that's when all the fluid is coming out of there and it's starting to soften. Again, we do not touch the BBL in these 6 weeks at all. We wait for everything to stick. We monitor your results. We check your garment and make sure that it's correct. Now, things that can harm a BBL. Number 1, your garment. A lot of doctors will give you a garment specific for your BBL, specific for what you're having done. Some doctors won't, and they'll kind of leave you on your own, and that's where we come in. We do virtual garment fittings. We can recommend you a garment for your specific surgery, your specific body type, what you have going on, and then of course, if you're getting lipo, you need a garment that's gonna be proportionate with your body, and that's where the biggest problem comes in because of the ratios. So if you're getting fat taken from your stomach, it's gonna be smaller. And if you're putting it into your butt, that's gonna be bigger. So the hip to waist ratio can be kind of tricky with fitting garments sometimes, which is why we do it person by person and don't recommend a certain garment, and we don't recommend a certain brand, and we don't recommend a certain size or a certain type. They do have different types of BBL garments. Every doctor has a different one. I would say go with your doctor's garment that they choose for you first. We always want to go off of what your surgeon or physician says. So BBL garments, they have the ones with the cutouts where your glutes are literally hanging out of the garments completely unprotected. I would shy away from those. But again, if your doctor is giving you that garment to wear, please go with what your doctor says. We always want to follow those rules first. So they have the ones with the straight up cutouts. If you are buying garments on your own, I really wouldn't suggest that. Again, there's no protection, and the circle tends to kind of squeeze your BBL results, especially if you got fat transfer on the sides as well as the top. That leaves a nice big ring right in your results, which is super scary. So we kind of want to shy away from those. There are other garments that have this like mesh netting inside that does the same thing. It's like a circle, and then the outside is covered with more of an elastic material to protect everything. Those are just as bad because that mesh netting and that circle is going to cut into your glutes and leave really big indents on your sides, which can be a huge problem come time for your results to actually be shown through at week 6. It can permanently damage your BBL. So we want to also stay away from those with the mesh netting inside. The best kinds of garments for a BBL, which is the ones that we have and sell in the office, as well as we can do a virtual consult for and recommend, are the ones that have a BBL area where the proportions are cut differently. Now, how do you know if the proportions are cut differently? Well, you don't. That's where you come to a specialist. But those garments that have it covered but show that it's like a different color or like a different like weird material, those are safe for your BBL. Those are our top pick. Why? Because the proportions of the garment are cut completely differently. So the garments that we use, our BBL area is the same exact material as the rest of the garment. The difference is the BBL area proportions are cut completely different for compression. So you have to be very, very careful when getting a garment. And if you're not sure if the garment that you have fits you properly or if it's safe for your BBL, please contact us. We can set up a virtual consult and get you going with something that's going to fit you properly and that you're going to feel comfortable in. With your BBL, you do not want to be changing garments, and this is where the problem comes in with your stomach. If your waist is shrinking tinier, then obviously your BBL is, because that's where the fat is sticking. We're going to run into some problems because you're going to want to be in a smaller garment to fit your waist so that your waist is shrinking, but your glutes need to still be the same size. So how do we get around this? We have specific garments that are meant to be pull tighter around the waist and the proportions on the hips stay the same. We have different ways of making sure those garments and those proportions are going to work throughout your entire recovery. So recovery for your BBL is 6 weeks minimum. That's when you're like, okay, I'm really fluffed, I'm really good, this is great, I really start seeing my results. Then usually around week 8, you're like really, really good. Some doctors will say you can sit right after your BBL. I would highly, highly, highly discourage that because we want to be on the safe side and we want to protect your results. Now, again, if your doctor says so and you think it's okay, that's fine, but we are on the side of caution. So being cautious, we kind of want to wait a little bit extra. Definitely the 6 weeks at minimum. Some doctors say after 6 weeks, you can stop wearing your garment, you can sit, you can lay, you can do whatever you want. Again, you can do that, but again, we want to err on the side of caution. I would say no sitting on it, no laying on it, no constrictive clothing, nothing like that, 6 to 8 weeks out. Something else to think about, a lot of people don't wear undergarments when they're wearing their regular compression garment, and that's totally fine. But there are some people that do, especially if you're not wearing your compression garment after 6 weeks. If your BBL has any hard spots at all, or any tender spots, or anything at all that still gives any kind of signs of healing, you should not be wearing underwear. No underwear at all. Those Victoria's Secret or those Fendi underwear that have that really thick elastic band, that is cutting into your BBL. Nothing constricting at all. Same thing with your chest. If you are getting all the fat transfer to your cleavage in your chest, if you are getting something there, we do not want to wear a bra. We don't want anything that's going to cut into that. We want to wear maybe a light camisole, a really baggy t-shirt. We don't want to wear a bra at all. Nothing that's going to cut into our results for 6 to 8 weeks. Nothing at all. So what can we expect as far as healing? Well, we got that week 1 to 3 where it's really hard. You're also going to be very bruised because they're going in there and your skin is stretching because they just added volume and tissue. It's not going to be, anything major, but it is going to stretch a little bit. It's going to be a little uncomfortable. Your skin's going to be very dry and hard and stretched. You're going to have bruising. You're going to have swelling. And then after that, it's going to start to come down. Other things that can look unsightly is the dimpling, the little bit of roughness, the little divots from where areas that had more work and areas that are now fluffed, that little change there in the 3 to 6 weeks that kind of gets a little sketchy. Those are things you should, be careful of, worry about, and look at. But those are also things that we can talk about and I can look at and give you more advice on as far as healing in a consult that we do virtually. You can contact us through Instagram, you can contact us through Facebook, website, phone call, DM, email, all the resources, all the ways that you can get to us. You can reach out to us for any of those things. There are lots more tips and tricks that we will have coming on our BBLs. If you guys have questions about BBLs, BBL pillows, which is a huge, huge, huge thing. We will be doing a video on BBL pillows. Your BBL pillow is a little brick that has little indents cut out in it. And you should be sitting on that with your thighs, not your glutes. The point of that is to keep your glutes elevated off of wherever you're sitting. You really shouldn't be sitting at all for 6 weeks, as we very well know. So that's a little bit about BBLs. That's a little bit about the garments, the pitfalls, the things you got to worry about. Fat transfers, also as it's called. Some doctors like to do a little bit more natural. Some doctors in Miami like to do a little bit of Cardi B action with it, little Nicki Minaj action back there. It's all based on what you want for your body and what makes you feel good. We are here to support you no matter what. If you need referrals for doctors who do certain kinds of BBLs, either in Miami, New Jersey, Massachusetts, New York, anywhere that you are, we are more than happy to help. Please feel free to set up a pre-op consult with us where we can go over what your goals are, what you're planning to achieve, and how to get there in the safest, fastest, and easiest way. Thank you guys so much for watching. I look forward to seeing you all again. Thank you, thank you, thank you. Have a good night. Bye.